a little nerve that comes this way and gives innervation to the toe on this side and this side, this side and this side. So most of the time people will note pain between the second and third, or third and fourth, what are called metatarsals. And what we're looking for is this inflammation in the nerve and swelling in the nerve right there between the toes. Okay? And these small nerves start to get irritated and inflamed, and they start to feel, first of all, a sense of burning or stinging, and then gradually numbness or a sense even of a stocking that's not on, like an extra heavy stocking. Most often it's pain, and it's pain most often with weight bearing. Okay. Now let's talk about the anatomy of the foot. So we've kind of established what is a neuroma. Let's talk a little bit about the anatomy of the foot. How many of you know that we have an arch in the foot? You have foot arch, right? Did you know, though, that there are actually 3 arches to the foot? Are you aware of that? So if we look at the foot, there is the large longitudinal arch that we're all familiar with. Okay? And that's the large arch. But on the opposite side of that, there is also a small arch. Okay? So on the outside of the foot, there is also a small arch. And that's also longitudinal, but it's not the large. So we have a medial and a lateral longitudinal arch. And then what we also have is right behind the toes, there is another arch as well that is considered what we call a transverse arch. So if we turn the foot so that it's facing forward with the great toe here, what we find is that there's also an arch from side to side this way. So if we were to actually look at the toes, they'd also line up on an arch. So if you look at it from the hand, there's a transverse arch also. Okay? So when the foot is actually weight bearing, there should also be a transverse arch. Okay? So we have the longitudinal from the heel forward, that's the medial. Then we have a lateral longitudinal arch, and then we also have a transverse arch that goes across behind the toes in the ball of the foot. Okay? Now here's something else that I find that's really interesting. Did you know that you also have 2 kneecaps in your foot? Are you aware of that? Underneath the great toe, or the big toe, okay, there is a set of small bones here, right underneath this transverse arch, or at the beginning of the transverse arch, and these 2 small sesamoid bones are just like, let me rewrite that for us, just like kneecaps. Okay? The sesamoids are just like the kneecap in that they are not a bone that actually has a responsibility for gravitational loading or weight bearing, but it is embedded within a tendon. Okay? So your quadricep muscle comes down and your kneecap changes the angle of pull of that quadricep group, so we actually have leg extension. Okay? And that kneecap is embedded within the tendon. The same with these small sesamoid bones. They're embedded within the toe flexors, and these very commonly are sources of pain or sites of pain. You'll hear it very commonly with sports injuries. When a young person gets injured, they'll call it turf toe. Have you ever heard of turf toe?
Yes.
Okay, very, very common in football players, because when they're running on that turf and they plant, they'll plant hard and these little sesamoid bones will actually roll this way, and it causes a tremendous amount of pain because that tendon, as it's going through there, is now irritated. Okay? The simplest treatment is to actually take and tape that and bring them back across, and it'll give instant relief. Okay? It's pretty fascinating. We do a little tab tape job where we'll actually take the tape, lay it down first directly on the foot, and the toe comes out like this, so just behind the toe. and then we make a little tab. And this is the work of a Dr. Tim Brown out of Newport Beach, California. He calls it sport taping. And you make a little tab with the tape right there, let the tape lay across underneath, and then you take another type of tape over that, and you catch that tab and pull strongly under, and it realigns those sesamoid bones, and it feels great. Okay. We also use a little instrument and adjust those back that way, and it gives a lot of relief quickly. Okay. So if we have then a longitudinal arch that's medial, lateral longitudinal arch, which is a short arch, and then a transverse arch here, each one of these arches must be preserved to some extent in order to maintain appropriate function. Now, how many of you have ever seen Polynesians? How much arch do they have in their feet? Flat feet, huh? None. But what you'll notice is they have very meaty feet, and those meaty feet are very, very strong. So along with the muscles that run in these, or excuse me, the nerves that run in between these bones are small muscles called lumbricoids. Okay? Now what's a lumbricoid?
A small muscle that runs between those muscles.
That's right. It is also a family of roundworms. Okay? So these little muscles look like worms. But instead of calling them verms or vermiform, right, they are called lumbricoid, or roundworms. And these little roundworm muscles have a very specific function. They maintain the transverse arch, and they maintain the longitudinal arch as well, or they maintain the integrity of the foot. Okay? Now here's something that I find absolutely fascinating. When we look at these small muscles, there are various bones that make up the foot. The calcaneus, we look at the talus and the talar dome, and then we have the cuneiforms and the metatarsals that come out this way, and the scaphoid or cuboid bone here. When we look at these bones, though, the amazing thing that I find is that the way that they move, of course, is just like the rest of the body with muscles. But these small muscles in the feet actually have direct co-innervation to the muscles of the spine. Okay? Inside of the spine, between the vertebral segments, back in the back where the spinous process rests, there are small, small muscles called multifidi muscles. And those multifidi muscles do incremental movements. So we have the large paraspinals that are our large postural muscles with our gluteal muscles that help us to stand upright. But the tiny rotatory, and then which are rotatory muscles, and the multifidi muscles actually engage and are directly linked or co-linked to these small lumbricoid muscles of the feet. Isn't that fascinating? Now think about this. If when we look at the body, hi, welcome. If when we look at the body, the child as it's forming has to go from being able to push up, then to be able to roll, and then to be able to come to its knees, and then to be able to pull itself upward, it will not pull itself upward until the feet are able to hold it upright. Okay? So isn't it interesting then that as our feet get weaker, how we start to also exhibit back pain? And that it also almost pushes us back to all fours again. Okay? So the health of our feet is actually an indication of the health of our spine, and assists then in resisting anterior translation of spinal segments, which can then lead to a condition called hyperlordosis, or even in advanced conditions of then where this bone actually starts to have a fracture in this weight-bearing portion of the spinal bone called the pars interarticularis. That can actually fracture, and if that fractures and this bone starts to migrate forward, we have what's called spondylolisthesis or spondylosis, okay? Or anterior migration of the spine and a hyperlordotic presentation. So you start to see a person with a sway back. When you touch their spine, the L5 segment almost disappears. Or if it's actually fractured here, the spinous process will become very, very prominent, and you'll feel a step where it actually steps out. Okay? So what we'll notice though is that as this back pain increases, so does the foot pain and my ability then to walk. Okay? Now, another thing that's very common with a loss of the transverse arch, besides the neuroma presentation, is a callus formation then behind this second and third toe in the ball of the foot. Okay, have you ever seen that where a person will start to develop a big callus? People who have neuromas know exactly what I'm talking about. There will be a big yellowing callus, almost like a corn, right there underneath those toes, because as you lose that transverse arch, you start to actually bear weight on this portion of the joint rather than the transverse arch. Okay? And that becomes very, very uncomfortable. Please.
I wonder how much of that is responsive also to the foot gear that you're wearing. Because have you noticed a cycle in footwear that, like, for 5 years ago, the trend was everyone wore Crocs, which have no support at all.
Right.
And now 10 years later, everyone has to wear these shape-ups to put support back in. It's like we throw ourselves in and out of whack, and I wonder if it's all those small muscles accommodating, and then they over-accommodate, and you have to go the other way. Do you think it could be something like that?
Definitely. So the question is, does footwear contribute or also distract from? One of my biggest cautions is when people start to correct or use corrective shoes to take away from the responsibility of the muscles. Okay? If I have an arm that aches and I'm always in a brace and I function this way all day long, okay? I take the brace off at night and I try to move my arm, how well does my arm move? Not so well, right? Same thing with the small muscles of the feet. There are appropriate times for corrective orthotics, but I think that more often than not, we over-prescribe them, okay? I've been practicing now since 2002, and I've made 2 pairs of custom orthotics for people in all of that time, okay? But that's just something that I have found, that there are different ways to treat the feet rather than saying one size fits all, okay? So,
what are some of the other ways to treat your feet? Just real quick.
we'll go through those tonight. I'll
Wow,
actually
I came to
show
the
you.
right class. Huh?
Yeah, this is the class for you, Barb. We're actually going to show some ways to help tonight, okay? So, again, the neuroma then is an enlargement and inflammation of the nerve and the neural sheath of that small nerve that goes in between the 2 bones in that area of the foot. And it's primarily between the 2nd and 3rd and 3rd and 4th specifically, okay? Now, what are the common treatments for those? Orthotics is a common treatment, okay? Physiotherapy is a common treatment, so ultrasound and different modalities. And then many podiatrists are trained and skilled in actually opening this up and cutting those out, okay? Do any of you know of someone that's had a neuroma surgery or surgical procedure? What they'll do is go through the top of the foot. So we'll turn the foot now to the top, and where the foot comes forward, in between where the toes come out, what they'll actually do is go in and they'll make a small incision, and then what they'll do is actually cut right here, open that, separate it, and then dissect that nerve. Okay? So now you have numb toes. And the other part of that is often we'll end up seeing that they'll start to draw because they'll start to hammer, okay? Because you lose the part of the innervation of these small lumbricoid muscles and the small flexors, and what you end up is then a tightening of the large tendons, and so you'll start to see a drawing of the toe, and now you'll end up with this real strong looking hammer toe, okay? You've seen some of those with hammer toes before, okay? And we'll see that as a consequential follow-up. Several of our patients that have come in that have had these types of surgeries have ended up with hammer toes. Now, I'm sure that there are those who are very skilled that would say, not in my patients, but all the patients that I've seen that have had this type of a surgery every person all the way across the board have said, I wish I wouldn't have. Okay? And then the follow-up to that is, I wish I wouldn't have done this surgery either. Okay? That's just been my experience. Now, again, there are going to be others that will have different opinions, and maybe those people aren't going back. We're just seeing the people that it didn't work out for, maybe. Okay?